WVLK, and pleased to welcome for his first of several visits this week, Dr. Kevin Kavanagh. Dr. Kavanagh, good morning. Welcome aboard.
Good morning, Scott.
Good to have you on again. First thing that I want to mention is a headline that I saw that says, colleges with COVID outbreaks are advised to keep students on campus. And my first thought was, well, duh. It doesn't seem like you'd send them out into the world once they've tested positive, would you?
No, you wouldn't, but that's the problem with college students. They'll either head home or sometimes they still go out and party and mingle because they are absolutely immune to everything. They're indestructible. So that's not a good thing. Not even that you have to state it, but unfortunately you do. We're having massive outbreaks on our colleges right now. Several hundred schools have already closed. So,
all right. Alabama seems to be particularly hard hit in terms of the colleges, over 1,000 cases there.
That's correct. I don't believe they've closed yet, but they haven't stated they're going to continue to be open either. I think they're still looking at what they're going to do.
I'm looking for the article here to try to be straight on my information here. Here, the CDC saying that, and I'm not sure that this is news because this is something that people like you have talked about all through the pandemic, that 94% of COVID-19 deaths in the U.S. had contributing conditions. People aren't just dying of coronavirus. Well, 6% of them are, but 94% had something else that the virus helped to weaken their system to the point of death.
Well, yes, but it mainly occurs in older individuals who have comorbidities. The problem is, for example, the comorbidity was having a sick sinus syndrome of the heart. That would be reassuring. But with this virus, a comorbidity is obesity. About a third of the people in Kentucky have that, actually over a third. Hypertension, that's another third. Diabetes, that's well over 10%. Of course, a lot of them have more than one comorbidity. But comorbidity is anything. It's kind of like saying 100% of the people that are alive die of the virus. It's not very reassuring if you really look at it. It's more, I think, trying to reassure the public when we still need to be all at arms trying to prevent spread. And this doesn't even address the fact that even according to President Trump, the vast majority of people are now surviving because of treatment, but those survivors are now having trouble with disabilities, such as severe heart disease. And it is a huge problem. So when you look at this virus affects the heart, the lung, the kidneys in those that have survived, especially if you're in the hospital. This isn't very meaningful, even though it may be reassuring. And to me, when I hear this, I kind of think like they're trying to get the idea of spread the virus through the community rather than having the public taking the virus seriously and performing distancing, performing good hand hygiene, and wearing masks. And that, as you know, can really stop the epidemic. And I think that, Scott, if a good thing to talk about is the preschool article that I sent.
Story out of California talking about infections in children younger than 5 compared to those 5 to 11. And that's something we want to hear about because every day we hear the governor come on the air, Governor Beshear, talking about how many under 18s are getting it, but we don't necessarily, and we hear about some real young children occasionally getting it, but what does this information out of LA tell us?
Well, this is, of course, one state's experience, but it's a big experience. They had 33,000 schools, actually almost 34,000 schools that opened. These are preschools now. And in the last 6 months, only 450 cases. So it really tells us two things. One, these children may be less infectious. It may just be because they're smaller size. They can't physically carry as much virus, even though the viral load per tissue may be the same. But the other thing is, California has very strict rules and acceptance with the preschools of social distancing the kids every 6 feet apart. Everybody wears masks, including children over the age of 2. Child goes to the restroom, they clean the restroom. Child drops a toy, they pick the toy up and clean it. So they're really doing strict public health precautions. And if you can remember the hairdresser who was positive for COVID-19, actually, I believe there were two of them, and they saw 140 clients and exposed another 200 to 300 people in their hairdresser shop. Everybody wore masks, nobody got infected. So this is the importance of wearing masks and following public health advice. So there really is a huge amount of hope here. And it states what we've been saying all the time. Let's follow public health advice. That in itself can defeat this virus.
We talked about the college kids, and we joke about, well, what do you expect? They're college kids. They're going to behave a certain way, and we should have known that coming in. But we also think that way as you talk about the preschoolers, about younger children as well. I've seen a joke going around on the internet. I can't remember if it was a cartoon or a photo of the mom saying to the kid, "That's not your mask." He said, "No, I traded with Johnny because his was neater." And you know somebody's going to do that at some point.
Well, I know things like that can happen, but nevertheless, in California, where they're very strict about it, they get the kids to buy in and they get them kind of trained and used to following these strategies that they don't spread the virus that much. At least that's what California is reporting. And that's good news because, this is an age group that you need to get taken care of if parents are going to go back to work. And that is crucial. And that's whether or not the parents work at their home or whether or not they work actually at the store or someplace else. They need to get the children taken care of and someone to watch them. And so this is very good news, but it does require us buying into these strategies. And of course, we've also talked about the importance of airflow. In this article, they talked about having activities a lot of times outside, which in California you can do, especially Southern California, year round. So all of this will tend to mitigate the spread of the virus.
All right, tell us about Healthwatch USA.
Well, Healthwatch USA is a nonprofit organization. We are dedicated to infectious diseases and also on research integrity. Infectious disease is by far our most active area that we've been in over the decade. We have a lot of COVID-19 resources online. If you go to healthwatchusa.org, we've got some very good continuing education programs which either have been used or are currently being used for educational credits of medical professionals, along with a number of publications that we've done for COVID-19, although most of those have been in the gray, in fact, all of those have been in the gray literature, but there's still a lot of good resources for people to look at.
Dr. Kevin Kavanagh, thanks as always, and we'll talk to you again on Wednesday.
Thank you.